Hey, welcome back. Ontario is reporting 3,947 cases of COVID-19 today. That's a slight dip after many weeks of being above 4,000. It's also the same week the Premier himself had to self-isolate after one of his aides tested positive for COVID. Then he emerged from his isolation.
I know we got it wrong. I know we made a mistake. And for that, I'm sorry, and I sincerely apologize.
As well as that apology, the Premier promised to bring in some sort of paid sick leave in the province. It hasn't stopped the criticism from the opposition, and many Ontarians, though, should point out that, again, we asked for multiple Ontario government ministers to come on this program to speak with us. We've done that every week for the past 6 weeks. Every one of them, every week, has said no. So we've gone to Andrea Horwath, the leader of the official opposition in Ontario with the NDP. Good morning, Andrea Horwath.
Good morning, Rosemary. How are you?
I'm good. And not to make you not feel wanted, but I do think it's important to let people know that we did try to get some accountability from the government on this issue. I want to start with some recommendations from the Ontario Science Table suggesting that the vaccine program needs to change in this province, that it needs to really be focused on hotspots. Do you agree with that? And where would you like to see that, or how quickly would you like to see that change happen?
The change should have happened already, and yes, I absolutely agree with it. Part of the problem that we have here in Ontario is that the government has consistently ignored the advice and recommendations of the Science Table, and really the ravaging third wave we are in is because Doug Ford brought us here. And so, yes, absolutely. It's the obvious situation where the fire is raging the hottest, where the flames are the biggest, is where you put the fire hose, and that's what we need to do here in Ontario.
The Premier last week, at the end of last week, started finally talking about paid sick leave, and I only say finally because many, many, many people have asked for him to do this. They have yet to put anything on the table. What do you think that could or should look like?
Well, you're correct. I mean, it's been over a year now that the Science Table has been recommending the paid sick days. Last week in the legislature, it was the 23rd time we voted on paid sick days. We brought it in dozens of times. And so the government, again, has refused to agree with that. So what do we need? We need a program that's easy, that people don't have to jump through hoops to obtain, that is immediate. In other words, it doesn't affect, your pay will not be affected, and that there's no loss in pay. So those are some pretty fundamental principles we want to see, and we just hope that the government really does the right thing here and doesn't provide a crumb or half a loaf. People are losing their lives. Entire families are ending up in ICUs, and we just have to stop the spread, because as you know, our hospital system is buckling and it's impacting everybody in Ontario.
Well, I'm glad you brought that up, because as you know, the Premier has reached out to some provinces. He's had a good conversation with New Brunswick. I think there's about 20 nurses or doctors coming from Newfoundland. But the federal government has also said, we're happy to help Ontario. The Prime Minister on Friday said he had 100 nurses or doctors ready to come into Ontario. But from what I understand, that offer has not been accepted yet. Why do you think there is a reluctance on the part of Doug Ford and his government to take the help from Ottawa?
Well, Rosemary, I certainly hope it's not for political reasons. That's the last thing we need right now. We need all the help we can get. And myself and many others have been urging the government to reach out and to not leave any stone unturned in terms of trying to get some help. So I was shocked a couple weeks ago when we found out that the government refused the offer of Red Cross help from the federal government. I don't know why Doug Ford is stubbornly doing that. And as I said, this is about saving lives, not about politics. So it's time the government focus on saving lives and stopping the spread of COVID-19. Again, I really sincerely hope it's not about politics, but we have field hospitals popping up across our southwestern Ontario communities, and where's the staffing going to come from? Who's going to staff those beds?
You used words on Thursday about language like spiraling out of control when you talked about COVID cases in the province. While it is true that ICUs are full, hospitals are full, cases are not actually spiraling out of control. The lockdown measures are starting to take effect. You see that with the numbers today, finally under 4,000. Is it helpful to use that kind of rhetoric, Ms. Horwath, when you were talking about this situation?
Well, I mean, I don't think that one day of numbers under 4,000, slightly under 4,000, indicates a trend. So I think we have to be very careful about that.
But there is no exponential growth in the province. They are starting to come under control.
But having said that, what we have is whole communities that are on fire with COVID-19, and that is the case. We don't see the epidemiologists and the doctors suggesting now's the time to put our feet up and assume that we've got the variants of control, or the variants of concern under control. I think that's the mistake the government made last time, and so keeping the urgency on, pushing the government not to stop and to actually start implementing the kinds of solutions that they've been told would be effective is exactly what I think we should be doing as the opposition, and we're going to continue to do, to fight for those people's lives.
Yeah, I'm not suggesting the situation is good. I'm simply suggesting that the data shows that it's moving in a different direction. The Premier apologized for some of his actions last week. I'm not sure what you made of that apology, but in this kind of situation, would you also feel the pressure of, trying to keep the economy moving, balance with public health measures, taking in information from the science table, or have you sort of given up on the Premier's ability to balance those things at this point?
Well, I mean, I think we need to look at where jurisdictions have been more successful in stopping the spread of COVID-19 and take the lessons from those jurisdictions. I think really what we know, what we've seen is that we're not going to save the economy if we are not saving people. It's people that actually make the economy operate. So we really do have to focus on those science table recommendations and save lives and stop the spread. So, again, I wouldn't say that, that any leader has had an easy go here. It's been tough. All of the leaders, whether it's provincial, federal, internationally, there's no doubt this has been, really very trying time. But it seems to me evidence is coming out that this, for the Ford government, has more been about politics, about, listening to the kind of anti-shutdown, anti-science wing of their caucus instead of focusing on saving lives, and that's troubling.
Okay, Andrea Horwath, very good of you to make the time for us today. Do appreciate it.
My pleasure. Thank you.
That's Andrea Horwath. She's leader of the Ontario NDP and leader of the opposition.